you. And thank you for the presentation and for bringing this case to the group. I think that the first thing I would say is that I want to think about the group that is here, right? So we have a lot of folks who are educators and therapists and psychologists, and I want to make sure that we're thinking, I'm going to talk about my response in the context of how I would think about how this affects this young man in school, right? This young child in school and how that would be. And so I think the first thing I would say is that when I'm seeing children who have tics, I'm thinking a lot about how it's affecting them, right? So like what's happening in school, how are other kids who are around them responding to them? How are their parents setting a narrative for how they should think about this? Because I think the first thing to think about is that there's nothing wrong with them. They're exactly who they're supposed to be. And we need to make sure that this part of them that makes them look different is also allowed, that they're getting the self-confidence that they need to know that that's true. In general, I would say that when we're thinking about treating tics, and again, I'm not a neurologist, and that's primarily the folks who are treating them in the neurologists and psychiatrists, but I see them quite a bit. And I think the first question is it causing causing the child distress in the environment that they're in, and is it disrupting their ability to learn? Is it disrupting their ability to interact with their peers and to do the things that they should be doing? So I think that's a question I'm asking. The second is, how aware is the child of those tics? This little boy is 7.5, right? So I think, how aware is he? So I think the first piece that you mentioned, Silvana, in terms of educating the family about that and educating the family so they can support the child, I think is really important. I tend to not give medicines primarily to address tics. And what's not, it's really first addressing the underlying issue that's affecting the child. And I'm correctly, and I want you to give me feedback, sounds like anxiety is a big deal for this little boy. So I think treating the anxiety is important, education for the family, and there's a really good parent education resource that we can share with you from the American Academy of Child and Adolescent Psychiatry. It talks about what tics are. And a lot of the therapy that you're mentioning too is really increasing awareness and in a developmentally appropriate way, right? Again, he's 7.5. So I think it's about increasing awareness, addressing anxiety, doing as much non-medication based things that we can, because the medication is not going to fix the tics. This is going to be something that this child has to learn how to live with, respond to, and be part of his own identity as he grows. So I think that's an important element. And I think that's an important piece of the video you showed too, is that's a really great video that HBO put out a few years ago, really sort of talking from a self-advocate's perspective, like from a child who actually experiences this, what does it feel like? And they absolutely can cause a lot of distress. And I think it gets to this whole piece of other people responding to something that's different, and other kids, right? Kids know when something's different and how that can affect them. So I did a lot of talking, but that's the general approach that I take.